Encephalopathy means disorder or disease of the brain. In modern usage, encephalopathy does not refer to a single disease, but rather to a syndrome of global brain dysfunction. This syndrome can have many different organic and inorganic causes. Terminology: in some contexts it refers to permanent brain injury, and in others it is reversible. It can be due to direct injury to the brain, or illness remote from the brain. In medical terms it can refer to a wide variety of brain disorders with very different etiologies, prognoses and implications. For example, prion diseases, all of which cause transmissible spongiform encephalopathies, are invariably fatal, but other encephalopathies are reversible and can be caused by nutritional deficiencies, toxins, and several other causes. Types: there are many types of encephalopathy. Some examples include mitochondrial encephalopathy, metabolic disorder caused by dysfunction of mitochondrial DNA. Can affect many body systems, particularly the brain and nervous system. Glycine encephalopathy, a genetic metabolic disorder involving excess production of glycine. Hepatic encephalopathy, arising from advanced cirrhosis of the liver. Hypoxic ischemic encephalopathy, permanent or transitory encephalopathy arising from severely reduced oxygen delivery to the brain. Static encephalopathy, unchanging, or permanent, brain damage. Uremic encephalopathy, arising from high levels of toxins normally cleared by the kidneys, a rare where dialysis is readily available. Anix encephalopathy, arising from thiamine deficiency, usually in the setting of alcoholism. Hashimoto's encephalopathy, arising from an autoimmune disorder. Hypertensive encephalopathy, arising from acutely increased blood pressure. Chronic traumatic encephalopathy, progressive degenerative disease associated with multiple concussions and other forms of head injury. Lyme encephalopathy, arising from Lyme disease bacteria, including Borrelia burgdorferi. Toxic encephalopathy, a form of encephalopathy caused by chemicals, often resulting in permanent brain damage. Toxic metabolic encephalopathy, a catch-all for brain dysfunction caused by infection, organ failure, or intoxication. Transmissible spongiform encephalopathy, a collection of diseases all caused by prions, and characterized by spongy brain tissue, impaired locomotion or coordination, and a 100% mortality rate. Includes bovine spongiform encephalopathy, SCRP, and Kuru among others. Neonatal encephalopathy, an obstetric form, often occurring due to lack of oxygen and blood flow to brain tissue of the fetus during labor or delivery. Salmonella encephalopathy, a form of encephalopathy caused by food poisoning often resulting in permanent brain damage and nervous system disorders. Encephalomyopathy, a combination of encephalopathy and myopathy. Causes may include mitochondrial disease or chronic hyperphosphatemia, as may occur in cysticernosis. Symptoms: the hallmark of encephalopathy is an altered mental state. Depending on the type and severity of encephalopathy, common neurological symptoms are loss of cognitive function, subtle personality changes, inability to concentrate, lethargy, and depressed consciousness. Other neurological signs may include myoclonus, asterixis, nystagmus, tremor, seizures, jactitation, and respiratory abnormalities such as Cheyne-Stokes respiration, apneustic respirations and post-hypocapnic apnea. Diagnosis: blood tests, cerebrospinal fluid examination by lumbar puncture, brain imaging studies, electroencephalograms and similar diagnostic studies may be used to differentiate the various causes of encephalopathy. Diagnosis is frequently clinical. That is, no set of tests give the diagnosis, but the entire presentation of the illness with non-specific test results informs the experienced clinician of the diagnosis. Therapy: treatment varies according to the type and severity of the encephalopathy. Anticonvulsants may be prescribed to reduce or halt any seizures. Changes to diet and nutritional supplements may help some patients. In severe cases, dialysis or organ replacement surgery may be needed. Prognosis: treating the underlying cause of the disorder may improve or reverse symptoms. However, in some cases, The encephalopathy may cause permanent structural changes and irreversible damage to the brain. These permanent deficits can be considered a form of stable dementia. Some encephalopathies can be fatal. See also, brain damage, neurobiology, neurobiological brain disorder, chronic traumatic encephalopathy, references. Adapted from, Office of Communications and Public Liaison. NINDS Encephalopathy Information Page. National Institute of Neurological Disorders and Stroke, National Institutes of Health. Further reading, The Diagnosis of Stupor and Coma by Plum and Posner, ISBN 0-19-513898-8, remains one of the best detailed observational references to the condition.